So the permanent maxillary canines are 2 in number, one on each side of the midline. So you have one right maxillary canine and you have one left maxillary canine. This tooth occupies third position from the midline. So after the midline, you have the maxillary central incisor, followed by the maxillary lateral incisor, and then you will have the maxillary canine. The maxillary canine is the largest tooth in the entire jaw. Largest in the sense that it has the longest root. So the canine has a very, very long root. This extra long root gives more anchorage to the canine, and that is why the canine is also considered to be one of the strongest teeth in the jaw. It is located at the corner, and that is why it is called as the cornerstone of the mouth. This tooth is also called as the cuspyd because the cusp of the maxillary canine is very, very prominent, resembling the cusp seen on the posterior teeth. The canine has slopes which helps guiding the jaws into the right occlusal plane. So you will notice that if the canine is malpositioned, that is either more buccally located or more palatally located, the posteriors tend to occlude more. So the interocclusal distance will be decreased in these people. And that is why the canine is important for guiding the jaw into the right occlusal plane. So when does a maxillary canine really appear in the oral cavity? To understand this, we have to study something called as the chronology. So chronology will tell you when the formation of the tooth begins, when the enamel is completed, when the tooth erupts, and when the root is completed. Now you must remember that canines, the permanent canines, will always start their first evidence of calcification after birth. So they will always start developing after the child is already born. And the first evidence of calcification for the maxillary canine is 4 to 5 months. So when the baby is about 4 to 5 months, the canine formation actually begins in the jaw. The enamel is completed anywhere between 5 to 7 years of age. The canine starts erupting between the age of 11 to 12 years. So it is much beyond the eruption of incisors. And that is why you must understand that the age of eruption of the incisors is anywhere between 7 to 8 years of age. After that, you have a gap of almost 3 years after which the canine is going to erupt. So many times you will have a patient walking into your clinic and asking you why this tooth hasn't erupted. So you should be able to tell them that canine takes a lot of time. And why does this canine take so much of time to erupt? Primarily because of the area where the canine develops. So the canine develops somewhere very close to the nasal floor. So it has to travel a long distance to erupt in the oral cavity. And that is why canine takes so much of time to erupt. The root of any tooth will always be completed about 2 years after the tooth has erupted. That is because the eruption of tooth always occurs when the root is 2/3 complete. The remaining 1/3 of the root will be completed only after the tooth has come into occlusion. And that is why the completion of the root of the canine happens between 13 to 15 years of age. So let us understand the measurements of the tooth. How to measure a maxillary canine. So if you have a picture and you want to measure the tooth, you should know from where to measure. So when I talk about the cervico-incisal length of the crown, that is about 10 millimeters. It is from the cervical line extending till the tip of the cusp. If I look at the length of the root will be from the tip of the root till the cervical line. So from where the crown ended, the root is going to begin right from there. So the length of the root is 17 millimeters beginning from the cervical line till the tip of the root. The mesiodistal diameter of the crown is 7.5 millimeters, and remember this has to be measured at the point of maximum convexity. So wherever the crown is widest, that is the area you have to measure the mesiodistal diameter of the crown. The mesiodistal diameter of the cervix should always be measured where the crown meets the root and not at the end of the cervical line. So that is why the mesiodistal diameter of the crown at the cervical margin is 5.5. So you notice that there is a lot of convergence from the maximum curvature of the crown till the cervical line. The buccolingual dimension of this tooth is the greatest, and the buccolingual dimension or the labiolingual diameter, as we say, extends from the labial aspect to the lingual aspect on the cingulum, on the crest of curvature of the cingulum, and this is 8 millimeters in its dimension. The labiolingual dimension of the crown at the cervix will always be measured again at the point of maximum convexity, where the crown meets the root. So, at that location, when you see, the measurement is about 7 millimeters. Now, when you draw an imaginary line anywhere from where the crown is ending and the root is beginning, you can see that along this horizontal line, there is a curvature. The cervical line of the crown will curve towards the crown, and this is called as curvature of cervical line. So, when I draw the cervical line and I show the curvature of the cervical line, the crown curves towards the incisal tip, and this is called as curvature of the cervical line. It is 2.5 millimeters on the mesial aspect and 1.5 millimeters on the distal aspect. So, on the mesial aspect, the curvature, the cervical line curves more as compared to the distal aspect.